If I could ask all of you to stand and ask Chaplain Charles Creech to lead us in the invocation.
Thank you. Let us pray. May God grant us the grace to have gratitude. May God grant us the gratitude to have grace. Help us to be thankful for the help that we receive and to help others to run their race. Give us the courage to find ourselves so that we might courageously give of ourselves. Let us be the peace in the midst of troubles so that when troubles come, we can easily right ourselves. May our grateful hearts affect our minds and cause us to be humble so that if we were to ever fall, our friends won't let us stumble. Tireless in our study and work, we have been and will yet sustain if we with a thankful heart continue to remain. Bless us this day, I pray, with knowledge and with skill. Help us to save those in danger and cure those who are ill, to comfort the pining and bring hope for their grieving, and better life we hope for them because of our thanksgiving. In the name of every name we pray. Amen. Thank you.
Join me in the Pledge of Allegiance. Pledge allegiance to the flag
of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Thank you. Well, let me call this meeting to order in November, our November meeting. I have a statement to read relative to public comment. Any citizen, going to be a tough day if I can't talk. Any citizen desiring to address the hospital board should turn the speaker card to the board secretary. If the citizen's comments pertain to an item on the agenda today, the comment will be heard early in this meeting. Otherwise, it will be heard towards the end. Speakers are limited to, are asked to limit their comments to 5 minutes. Vendors, suppliers, or other persons seeking hospital contracts awarded on a competitive basis are reminded that their ability to address the board may be restricted by the terms of the invitation to bid, request for proposal, or other purchasing criteria. Lastly, the board has established a claims adjustment review panel comprised of representatives of the board, the medical staff, administration, and legal counsel to review and negotiate the settlement of claims. Accordingly, the board will not entertain comments or discussions or negotiate claims at this meeting. Thank you. Alrighty, let's start with approval of the orders of day.
I move approval of the orders of the day.
Second.
Any discussion? All those in favor of the motion on the floor, please signify by saying yes.
Yes.
Those opposed, nay. It is going to be a tough day. I can see that already. Next, we have approval of the minutes. Do we have a motion to approve the minutes of October 15th? Any discussion, additions, deletions? Hearing none, the minutes will stand as presented. Board reports. We have today is our annual organizational meeting, and at this meeting we will elect the officers of the board, chairman, first vice chair, second vice chair, secretary, assistant secretary, treasurer, and assistant treasurer. Do we have a motion for election of the slate?
We do.
All right.
So as discussed earlier today at the Governance Effectiveness Committee, I move election of the following slate of officers for the 2019 board year. As chairman, Joe DiVirgilio. As first vice chairman, Bill Noonan. As second vice chair, Jim Meister. As secretary, Greg Carter. As assistant secretary, Susan Tucker. As treasurer, Sharon Wetzler DePeters. And as assistant treasurer, Darrell Henry.
Do we have a second?
Second.
Is there any discussion? All those in favor of that slate of officers, please signify by saying yes.
Yes.
Yes. Opposed, no? All right, well, thank you. And thanks to the board for continuing support of me as chair. All right, we move on next to Dr. Fiorica, who will introduce Dr. Sell, who's going to talk to us about the state of your heart.
Yes, I'm pleased to introduce Dr. Jeffrey Sell, our Chief of Cardiovascular Surgery here at Sarasota Memorial Hospital. He did his background training. He went to Harvard Medical School in Boston. He did his residency in Boston at Brigham and Women's Hospital, and he did his fellowship at Boston Children's Hospital. He started on staff here in February 2013 and has pulled an excellent cardiovascular team around him. We're happy to have him talk today about state of the heart.
Dr. Sell.
Do the slides come up? There we go. Perfect. So I'm just going to give a nice report. It's an honor to be here, Mr. Chairman, members of the board, to talk about our program. As you know, we've had a busy year. This is the team of heart surgeons that we have, myself, Dr. Kelly, Dr. Vesco in the back row, and Dr. Hofberger and Dr. Fong. That's the tip of the iceberg, and we don't do what we do without an incredible team of nurses, of operating room staff, of technicians, of critical care people, of hospitalists, of every possible component of the hospital, making it possible for us to do what we do. Many of you saw this ad appear in the paper about us breaking 1,000 cases. That includes all open heart cases, TAVR cases, MitraClip cases, what we call thoracic cardiac cases, which are certain cases that are done through the chest for problems like arrhythmia, occasionally robotic heart surgery, a whole variety of cases. So 1,015 cases is a pretty good number, but the real question is, why is that important? And this is just a sense of how the program has grown over the years. There have been some changes over time to what we count, so we've actually included certain things so that the number is continuously increasing. This is the number of actual open heart cases that were finished in the June to July, or rather July to June 17 to 18, doesn't include the last 3 months that brought us over the 1,000. And this is sort of why it's important. If you notice these bar graphs on the far right, you'll see how high volume program expected mortality compares to low volume programs. And as you go from left to right, do more and more cases, your mortality rate goes down, which is an important thing. But even more interesting is who benefits from that. And certainly all of these, each of these lines represents a different amount of risk. And the top is the high-risk patients. And as you can see that the high-risk patients do better the more volume the hospital does. But surprisingly, the low-risk patients get an immense benefit from volume in a program. So as we grow, we do better things for a lot of people, particularly the low-risk patients, but also the high-risk patients as well. This is our CABG readmission rate, and as you can see, it runs up and down, but mostly below, certainly well below the what we call the U.S. national rate that CMS mandates. And a lot of that is important because we can get fined for readmission rates. So we've managed to actually maintain our levels and improve our levels over time in such a way that we've not had to pay that penalty. This is the last reported star rating category. I think ours may change in the next collection, but we are one of 2 hospitals that have achieved 3 stars in all 5 areas. That's a pretty small number. It's actually 2 hospitals, Sarasota Memorial and the Cleveland Clinic, that have been able to do that. This is about a 300-page document that reviews all of our results. And in order to achieve a 3-star rating, we have to be 95% confident interval that our number is above the mean for the STS. So that requires, it's a little better when we do more cases. Valve cases are a 3-year harvest. Coronary bypass is a 1-year harvest. But these results are really part by part. It'll look at hospital stay. It'll look at the patients we take care of. And we take care of a very high-risk, very complex population. We do a lot of very complicated surgery, and we have really a quite good record of taking care of these patients. As we have developed this record, we've become a go-to place. So, of course, Inglewood and Lakewood Ranch have been referring a lot of patients to us. Doctors Hospital, certainly a lot of the cardiologists there prefer to refer to us. But we even receive patients now from Venice, from Port Charlotte, from occasionally from Blake or Manatee for more complicated cases where they don't feel that they have the ability to do it. In the Consumer Reports, it's very interesting that they rate hospitals in aortic valve replacement and coronary bypass grafting, and they rate them by region. We happen to be in a region with the most hospitals that got 2 up arrows, and we're one of 9. We're one of actually 18 in the country that got that Consumer Report. And it's kind of interesting because there's a final report here that comes from the health grades where we were one of the 50 best hospitals in cardiac surgery in the country. A lot of people say, well, what about U.S. News and World Report? So they actually just published a study that showed that the STS rating, the Consumer Reports rating, and the health grades rating, along with the CMS, which I haven't put in here, but those are much more correlated to the quality of the program than the U.S. News and World Report. So where the rubber meets the road, where the numbers are available, where people look at actually how patients do, that's where we've done well. Our goal is the program has been to develop quality. We also have innovation. We're going to be the one of 32 hospitals in the first in Florida to start deploying a new TAVR valve. We have a high level of experience now with 5 surgeons who are at the 1,000 case load a year program, and breadth of experience. We have a very diverse program. We've developed a fairly good size aortic program. Dr. Duke Cameron is going to come and speak at our summit in February. He's one of the world's most renowned aortic surgeons, and his comment in his talks usually is that you should be doing at least 15 to 20 aortic cases a year to be considered an experienced program. We're doing 50 close to, and we do probably 1 or 2 a week now, and we're certainly following a lot of patients and getting very experienced in that realm. So between quality, innovation, experience, and diversity of procedures, I think we've really put together a fine program, and it's to the credit of the board that they've provided us the resources, and to Mr. Verinder that he's made it possible for us to succeed, and to the nursing and the support services that help us do what we do. So thank you for the opportunity to come today.
Thank you, Doctor, for the leadership you bring to that program, and I think the board had a discussion earlier today. We just look forward to what the future is that you will bring to Sarasota County. Thank you.
Thank you.
You got a question?
Cases are arch?
Doc, we have a...
Yes, we do ascending, arch. We share some of the endograft descending cases with Dr. Nair. He works with Dr. Fong, and they do some endo work there. We have avoided redo arches and what are called thoracoabdominals because those are very high intensity, high risk of paralysis, long-term care, better done in a center with residents. But as far as ascending aortas, dissections, arch repairs, we've been doing that. We've been doing antegrade, retrograde, cerebral perfusion, all the state-of-the-art kinds of things with excellent outcomes.
Thank you.
Thank you, Doctor. All right. Next up, we have 4 awards today. David, would you take us through it?
I would love to. So I'd like to invite, first off, Jan Cleves to come up and join me. Jan? How are you? Good. Good. So Jan, come stand up here by me so I'm not lonely. All right. So Jan is our November Excel Award winner. She's an external transport coordinator in our logistics center, and she's been with Sarasota Memorial since 2016. Jan's peers describe her as someone who takes pride in her work. She's dependable and so efficient, they say. Jan pays attention to details, which is invaluable in logistics, they explain. She does her job with a positive attitude and remarkable patience. We often get great feedback from our outside vendors about Jan, they say. From inside SMH, it's much the same. Jan has a real integrity and a wonderful work ethic. People enjoy working with her. Jan, thank you so much for everything you do to make us a great place. Thank you.
So on behalf of the hospital board, I'd like to present you the Excel Award. Excel recipients are employees who are models of excellence and consistently demonstrate the mission, vision, and values of our organization. They are superior performers that make an extra effort in the quality and care of our patients and families in the community. And again, on behalf of the hospital board and the president and CEO, David Verinder, I present this award to you. Thank you.
Thank you.
Yeah. Do you get this one?
Yep, she gets to keep this
This
one.
one?
Here, I'll hold it for you while you give your speech, Jan.
Okay.
All right?
That's the deal. I just want to say it is an honor to be here, and if I didn't have the team around me, like everybody always talks about, I had said before that I actually volunteered here several years before I sought out employment, and as a volunteer, you can kind of sneak around and see people when they don't see you, and I was so impressed with this hospital and the staff that I think you could give 100 of those out a month, you know. But it made up my mind that this is where I wanted to work, and luckily there was a position. But it's a true honor to come to work every day. So it's an amazing, amazing hospital. Thank you all.
Thank you.
Thank you, and we're glad to have you.
Thanks.
So I get to also have the privilege of introducing you to our leader of the quarter, Andy Bowden. Andy, come on up. So Andy is our Leadership Award winner for fourth quarter 2018. Andy's a manager in our facilities management and has been at Sarasota Memorial since 1986, more than 30 years. Andy's coworkers describe him as easy to work with, respectful, and a great teacher. They appreciate his common sense approach and his value to experience from being involved in firsthand with so many of the SMH projects. All the blueprints in the world will never be as accurate as Andy's brain, that his coworkers say, which is so true. Another says Andy does a great job in all aspects of his work. He maintains many large projects that most people don't even know about, but are necessary for the hospital's operations. From construction projects to facility management needs, you can always count on him. Andy, thank you so much for everything. We appreciate it. Thank you.
So I'm here to present to you the Leadership Award. If your actions inspire others to dream more, learn more, or do more, and become more, you are a leader. John Quincy Adams. On behalf of the hospital administration staff of Sarasota Memorial Healthcare System, we present to you the Leadership Award. I'll hold on to this.
Congratulations, Andy. Go make a speech.
Okay.
Yes,
Well,
yes.
I want to thank you. I'm very proud and humbled to receive this award, but it couldn't be possible without the great leadership that you all provide, plus the coworkers with their dedicated and devoted work for the hospital. So I want to thank you and them. So thank you very much.
Welcome.
Okay, I'm also honored to get to introduce you to our physician leader of the Leadership Award for our third quarter 2018, Dr. Dean Theopolopoulos. Dr. Dean, and that's the last time I'm trying that.
You did that well.
Here announced Dr. Dean, okay? Congratulations. So Dr. Dean is our Physician Excel Award winner for third quarter 2018. He's a neonatologist in our NICU and has been at Sarasota Memorial since 2005. Dr. Dean received positive nominations from all around from his peers and coworkers. Dr. Dean is a compassionate leader who takes time to mentor new physicians and educate staff as his coworkers. He's quick to commend the work and ideas of fellow staff and is a very supportive team. In their nomination forms, his staff wanted us to know that Dr. Dean also receives glowing reviews from his families of his tiniest patients. He goes out of his way for his patients and their families. He takes time to sit with them in times of joy and pain and has a way of making them feel like everything will be okay. Dr. Dean always remembers the children and families he's taken care of at the annual NICU reunion. He volunteers for this event every year and really looks forward to it. Thank you, Dr. Dean, for everything you do.
So on behalf of the hospital staff and our board, I'm here to present to you the Physician Excel Award. Excel recipients are physicians who are recognized as role models of excellence. Superior in their performance, they are leaders who consistently demonstrate a collaborative team approach in their work. These individuals strengthen the quality of patient care and the image of Sarasota Memorial Healthcare System in our community. Thank you.
Thank you.
Congratulations. Give a speech.
Thank you. I'm very honored to receive this award. And in the NICU, we're a hardworking team. It's a team effort. So without my team, this award would not be possible. They're very dedicated and hardworking, and you can rest assured that all the babies in Sarasota County and the surrounding counties that are transferred into us are in great hands. They're taken care of at the highest level. Thank you.
Okay, we have a hero award, but I don't see our hero here today. So Dr. Morandi is that, and I think we'll just wait till next month if that's okay with you, Mr. Chairman.
Thing is that she should get the full recognition.
We'll recognize him then. Okay,
Great.
thank you.
Thank you. All right. Next up, we have a medical staff report, and I guess, Jim, you're going to be handling the pitch hit of the pitch hit, I guess.
Right. Yeah, yes, on behalf of the medical staff, we have 5 motions seeking your approval. The first is surgical privileges for advanced practice professionals. Next is the compartment syndrome Stryker special procedures for advanced practice professionals. Third is the multidisciplinary surgical anterior oblique approach special privileges. Next is the diagnostic and interventional radiology privileges. And last, the 2018 and 2019 medical executive committee roster. These motions have been approved by the medical executive committee seeking board approval.
Okay, you ready for 5 motions here?
There you go.
One
Here
at
we
a
go.
time. Okay, first, I move approval of the surgical special privileges for advanced practice professionals as recommended by the medical executive committee.
All right, any discussion? All those in favor of the motion on the floor, please signify by saying yes. Yes. Opposed, no?
Okay, number 2, I move approval of the compartment syndrome Stryker special privileges for advanced practice professionals as recommended by the medical executive committee.
Discussion? All those in favor signify by saying yes. Yes. Opposed, no? Okay.
Third, I move approval of the multidisciplinary surgical anterior oblique approach special privileges as recommended by the medical executive committee.
Discussion? All those in favor signify by saying yes.
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 Okay, fourth, I move approval of the diagnostic and interventional radiology delineation of privileges as recommended by the medical executive committee.
Discussion? All those signify by saying yes. Yes. Opposed, no? Ready?
And finally, I move approval of the 2018 and 19 medical executive committee roster as recommended by the medical executive committee.
Discussion? All those in favor signify by saying yes.
Yes.
Opposed, no? Alrighty.
That concludes
Bill, thank you.
my motions.
Alrighty. For this page or for the day?
For right now.
Alrighty. Okay, well, thank you. And Jim, thanks for pitch hitting. Next up is the foundation report. Mason Harris.
All right. Thank you, Mr. Chair. Wanted to draw your attention to the SMH Today publication. May have received this recently in your mailbox. This edition is a little different than the publication that's been done in the past, in that in the middle of the publication is a insert for the foundation. We have rebranded our magazine that we did for many years called Envision, and we now have what we call impact inserted in the SMH Today publication. This is a joint effort between the hospital and the foundation. I want to thank Peter Taylor and his team, their ability to work with our team to put this publication together. And I want to also make you aware that the next edition is going to be coming out in February, March. So check your mailboxes. We are looking forward to continuing to use this as a vehicle to let the community know about all the great work the hospital's doing, as well as the foundation. And finally, I just want to say again, as I almost say every month, that the big hospital gala is just around the corner, January 12th. Space is continuing to fill up fast. We are getting close to a sellout, but it will be a wonderful evening to celebrate the great work of the hospital and also the cardiac services team. So I would encourage you all to be there. That concludes my report, Mr. Chairman.
Thank you. And that was an excellent product this year. You said it was coming, and it came, and I like the way it came together.
Good.
Thank you. Thank you. Right, Susan Tucker, you're going to handle the secretary's report.
Thank you, Mr. Chairman. The SMH Board calendar, December 2018. On Monday, December 17th, 2018, the board will meet from 9 to 10:30 for Human Resources Committee. From 10:30 to noon, Mission and Planning Committee will meet. From noon to 12:30 will be a closed session for the hospital board meeting. From 12:30 to 2, the board lunch and issues and financial review will meet. And from 2 to 4 in this room will be the public board meeting. That concludes my report, Mr. Chairman.
All right, thank you. Next up is the treasurer's report. Sharon?
Yes, thank you, Mr. Chairman. I move to approve the bad debts and charity care for the month ended October 31st, 2018 in the amount of $20,739,000.
We have a motion and a second. Any discussion? All those in favor of the approving the motion on the floor, please signify by saying yes. Yes. Opposed, no? Righty. Thank you,
And that
Sharon.
concludes my report, Mr.
Thank you.
Chairman.
All right, next up, financial highlights. Our CFO, Bill Wojcik.
Thank you, Mr. Chairman. I have the highlights for October, and with October being the first month of our fiscal year, the fiscal year-to-date numbers are same as the month. Starting with operating revenue for the system, operating revenue of $74,137,000 compared to a budget of $70,625,000. Moving to the system's operating expenses, $72,532,000 compared to a budget of $70,272,000. For our operating income in the rating agency format, for October, $5,628,000 compared to a budget of $4,279,000. The operating margin was 7.1% in October compared to a budget of 5.7%. Looking at statistics for the hospital, the average daily occupancy $514 compared to a budget of 500, and our average acute length of stay 4.26 days, whereas last year it stood at 4.48 days. Staying with statistics, the surgery cases for October, 2,139 compared to a budget of 1,913. And our outpatient registrations, 39,664 compared to a budget of 36,985. Our emergency care registrations, 10,044 compared to a budget of 10,092. And our case mix index for all patients, 1.91, and for Medicare patients, 1.93. Mr. Chairman, that concludes my report unless there's any questions.
Anybody have any questions? Thank you, Bill. Next up, committee reports. We start with the Governance Effectiveness Committee and Greg Carter.
Thank you, Mr. Chairman. The Governance Committee, Executive Committee met today earlier, and we approved the minutes of the meeting of April 16th. And our first item was the board meeting calendar for 2019. It was discussed and approved. And I move approval of the board calendar for the 2019 board year as recommended by the Governance Committee.
Have a second. Any discussion? All those in favor of the motion on the floor, please signify by saying yes.
Yes.
Opposed, no. Alrighty.
Thank you. Also, the list of current community and medical staff members of committees was discussed. And I would move approval of the appointments and reappointments of physician representatives and community members for the board committees as recommended by the Governance Committee.
Second.
All right, we have a second. Any discussion? All those in favor signify by saying yes.
Yes.
Opposed, no. Alrighty. Anything else?
Yes, the process for completion of the annual board self-assessment was discussed, and the process for the brochures for the 2019 leadership conferences were shared with the board. Members were asked to let the board assistant know if they were interested in attending any of these meetings at the earliest possible time. Also, board policies 710BD06, indemnity of liability arising out of committee service, and 710BD07, indemnity of liability arising out of peer review and other activities, were reviewed by council with no changes made and were approved. And at this time, I move approval of the board's indemnity policies as recommended by the Governance Committee.
Second.
All right. The motion is second. Any discussion? All those in favor of the motion, please signify by saying yes. Yes. Opposed, no. All right. Thank you.
Okay. Also, the annual update corporate compliance program was presented by Lisa Totten, our corporate compliance officer. And finally, our CEO, David Barrender, presented the 2019 organizational goals and updates on organizational structure and compensation strategy. And that concludes my report.
Great. Thank you, Greg. Any further questions for Greg? All right. Next up, the Finance Committee, Jim Meister.
Thank you, Mr. Chairman. The minutes of the August 29, 2018 meeting of the Finance Committee were approved. A proposal for the purchase and installation of next-generation storage technology was presented by the Director of Information Technology. This equipment will be more reliable, reduce maintenance costs, and provide capacity for growth. This capital expenditure is budgeted to cost $1,100,000 and has a life expectancy of 10 years. I move approval of the purchase of the next generation storage infrastructure as budgeted for the year 2019 for a total project cost not to exceed $1,100,000 as recommended by the Finance Committee.
Second.
Motion and second. Any discussion? All those in favor of the motion, please signify by saying yes. Yes. Opposed, no. Anything further, Jim?
To continue, David Patterson, our Associate Chief Nursing Officer, presented a proposal for a surgical renewal project which will renovate 3 orthopedic operating rooms, provide new surgical and anesthesia equipment, and renovate the post-anesthesia care unit. The operating room renovation includes the installation of a clear suite air exchange that will replace the old laminar flow units. The capital expenditure is budgeted to cost $6,731,000. And I move approval of the purchase of equipment and funding of construction for the renewal of project for operating rooms 8, 9, and 10 and the post-anesthesia recovery unit as budgeted for the year 2019 for a total project cost not to exceed $6,731,000 as recommended by the Finance Committee.
Second. Any discussion? All those in favor of the motion, please signify by saying yes. Yes. Opposed, no. All right. Jim?
Nelson Lane, our controller, presented for approval, the updated list of recurring wire transfers and HCH and other payments for the hospital, which is done every year. Nelson described the control mechanisms, both internal and external, which are in place to ensure our properly authorized transactions occur. And I move approval of the updated list of recurring wire transfers and ACH and other payments to authorize staff to initiate and authorize them as needed recommended by the Finance Committee.
Second. Any discussion? All those in favor of the motion, please signify by saying yes. Yes. Opposed, no. Anything else, Jim?
Yes, please. Thank you, Mr. Chairman. Maria DiCarlo, our Vice President of Rehabilitation and Post-Acute Services, presented a retrospective review of the Rehabilitation Pavilion, which opened in April of 2017. The project, which cost $2.4 million less than the approved budget, has improved the patient experience and increased bed capacity and market share. Financially, the rehabilitation services provided in the building exceed the pro forma contribution margin by 140% for year 2017 service and by 204% for the year 2018. And lastly, David Patterson, our Associate Chief Nursing Officer, presented a retrospective review of the transcatheter aortic valve replacement, a TAVR program. This procedure offers an alternative for those patients who are at high risk for surgical intervention and does not require the patient to recover in the intensive care unit. The annual volume has increased from 49 cases in the year 2013 to 224 in the year 2018, and these cases generate a positive contribution margin despite expensive supply costs. And that completes my report, Mr. Chairman.
Thank you, Jim. Appreciate it. All right, I guess next up we have the President's report. David?
Thank you, Mr. Chairman. I'm going to start like I do, looking at our report card for the organization. So you can see the first pillar that we take a look at is our service pillar, which is our HCAP scores. We have a goal of being 8 out of 11 HCAP domains at the 50th percentile or greater. Happy to report that for this year to date, which happens to be 1 month, okay, we're at 9 out of 11, so exceeding that goal. On the outpatient side, we have a goal of being at 55 out of 58 of the domains greater than or equal to 50% percentile. Happy to report that we're also exceeding that goal at 56 out of 58. In the people pillar, we have a goal of having our turnover of our part-time and full-time employees. Those have been hired within the last 12 months, being at 25% or less. I'm happy to report that we had a great month. We're at 21.31%. And in the quality pillar, we have our infection prevention, which is our combined overall standardized infection rate. We have a goal being less than 0.95. We are greatly exceeded that this year at 0.73. And it is, when you reflect on that the national average or expected is 1.0, it really shows you where we are in that process. In our finance pillar, as our CFO went over a minute ago, we had a operating margin of 6.5%, which we project out 6.6% for the year. In our growth pillar, we have our goal of being inpatient admits and outpatient observations being at 46,047. We are projecting higher than that right now at 49,802. And outpatient registrations at 894,000. We're projecting to be higher than that at 910,000. Moving into a little deeper dive into our HCAPS report, you can see the 11 domains on your left-hand side of the page. The current national average in the middle, and in the green is where we sit. So we are green on 9 out of the 11 of the domains. You can see the gap or overage on the far right-hand corner, and you see that we have the two that we've been challenged with for quite some time, which is cleanliness of the hospital environment and quietness of the hospital environment. However, making good strides throughout the rest of the list. You can also see on this next page our outpatient system report card. Once again, shows you the categories of the service lines on the left-hand side. What we were able to achieve, which was 56 out of the 58 domains, meeting the 50th percentile or better. Ambulatory surgery being the only place that we had any kind of gap in that data. So great results throughout there. In our service pillar, I want to just recognize again our event, the Key to the Cure, Key to Cancer programs, focus on Key to the Cure. A number of SMH staff helped out at the annual Key to the Cure event at Saks Fifth Avenue. A partnership between Sarasota Memorial Healthcare Foundation and Saks. The fundraiser has raised more than $1.6 million now over the last 13 years for Sarasota Memorial's women's cancer care programs. And Mason, just want to once again thank you and your staff for making all that happen. I know it's quite a big lift for you guys, so thank you. In the quality section, this is a huge milestone. SMH achieves magnet recognition in again. So Sarasota Memorial Hospital has received magnet recognition again, a testament of our health systems, nurses, and our organization's continued dedication to the top-notch care. SMH has earned the American Nurses Credentialing Center's magnet recognition program designation continuously since 2003, a 4-time achievement attained by less than 1% of the nation's 6,300 plus hospitals. Sarasota Memorial is among just 51 magnet hospitals to earn the designation 4 times. Valid for 4 years, our magnet recognition is the highest national honor for nursing excellence and a gold standard for measuring quality of care and professionalism in nursing practice. And just want to look over to my left and see Connie sitting there.
She's got a huge smile on.
Does she have a smile on? I'm not even looking at her, okay?
Well done.
So what we did do is we last Friday we had, was Friday, right? Or was it Thursday? Was it Wednesday? Time flies. Last Wednesday, we had I don't know, a couple 300 nurses in our auditorium, and had Magnet call in and tell us the score. Guess it would have been a real upsetting day if it had gone bad. But we had a pretty good idea it was going to go well, and we had our chance to celebrate with all of our nurses and thank them for everything they do. And Connie, appreciate your leadership and all that.
Well done, thank you.
Staying in quality, we received, the Leapfrog Group released its latest report cards this month, and Sarasota Memorial earned its 5th consecutive A for excellence in keeping patients safe from preventable harm and medical errors. In its fall 2018 survey, an expert panel evaluated more than 2,600 general acute care hospitals in the United States. About 32% of them, or 855, earned an A for demonstrating excellent record in patient safety. I will tell you that we have been an A-rated hospital ever since we've been participating in Leapfrog. So thanks to staff. So Sarasota Memorial recently earned recognition as a certified quality breast center of excellence, the highest quality designation awarded by the National Quality Measures for Breast Centers. SMH is the only Florida hospital among 61 in the nation to earn this designation. To earn certification, hospitals must demonstrate high-level performance on a number of quality measures, including imaging, surgery, radiation, cancer registry, pathology, and patient satisfaction. So thank you for all the staff who made that possible. So Sarasota Memorial, I'm staying in quality, was recently recognized as one of the world's most wired hospitals. So results from the 20th annual Healthcare's Most Wired survey released at the recent College of Healthcare Information Management Executives, or CHIME for short, Fall CIO Forum in San Diego recognized Sarasota Memorial among the world's most tech-savvy hospitals, pioneering technologies that promote better and more secure patient care. And I know she's sitting to my left as well. Pam Ramhofer, our Chief Information Officer, certainly leads a heck of a team to make that happen. So thank you, Pam. See, we have a good team over here, right?
You do. They have a CEO award?
Yeah, that's next month. So,
Hope is everything.
staying in the moving to the people category, our staff celebrated a successful 2018 Fall Festival picnic. SMH's annual picnic with a Fall Festival theme was recently held to recognize staff's many achievements over the past year, including retaining our 5-star quality rating from CMS, earning the Gallup Great Workplace Award, and setting a high bar for excellence with successful Joint Commission survey. So I know we had several members of the board make it out there. The staff, I think, really had a good time, and appreciate Lori Lang and Lori Bennett really making all that happen. So I think it was a very nice thing you guys did. Appreciate it. It's also that time of year we get to celebrate some of our excellent physicians. And this year we got a chance to recognize Dr. Dominic Cover, who's a nephrologist here, pictured on the above left, won the Health System's 2018 Lifetime Achievement Award, while emergency medicine specialist Dr. Ruben Holland, above right, was named Sarasota Memorial's 2018 Physician of the Year. Both were selected by a committee of physician leaders and recognized at Sarasota Memorial's annual medical staff meeting, which took place last month. So if you see either one of these gentlemen, please extend your congratulations. It's a big deal on the medical staff to have this happen. Staying in people, we had Dr. Steve Newman, who is a longtime Sarasota Memorial emergency medicine specialist and medical director for Sarasota County EMS. Received several honors from Longboat Key Town Commission for his outstanding service. Dr. Newman has been the county's EMS medical director for 35 years, in addition to his service as Longboat Key Fire Department's medical director. So we want to wish Dr. Newman happy retirement and congratulations on his long service. In the growth section, Sarasota Memorial's 6 urgent care centers now feature a free new app called Save My Spot that allows patients to check in ahead of time into our urgent cares. The app allows patients to select a time and the urgent care location that works best for them. Patients can use Save My Spot whether they are visiting an SMH urgent care or for illness, injury, routine lab work, or a physical. The app can be accessed from any smartphone, tablet, or desktop by going to the smh.com urgent care or downloading it from the app stores. So please take time and do that. Looking at growth, we heard Mr. Meister give a good report this morning in the Finance Committee on really the amazing work that's been done at the Rehab Pavilion. Last month, we did open 10 new beds to increase capacity in that facility. The center now has a total of 54 private patient rooms, and which brings the overall bed count to 839 throughout the system. And staying in growth, our progress continues on our new parking garage, which can't happen fast enough. So for everyone who has a difficulty parking here, we apologize in advance, but we do have a new 583 space parking garage that's opening in December 2018. It'll be late December. Staying in growth, we got the opportunity to give an update to our neighbors on the new hospital in Venice. Sarasota Memorial hosted a neighborhood workshop to give community members an opportunity to see renderings and hear about plans for the new Sarasota Memorial Hospital Venice, which is slated to open in 2021. Sharon, are you here, Sharon? Yeah, Sharon also to my left. Had a chance to get up and really take a lot of questions from the community, answer a lot of questions, and give our vision. And I thought it was very well received by the residents there.
It's well done, David. Thank you.
Thank you. We always, staying in growth, we always have a number of community programs, free lecture series. I would invite anyone in the public to go onto our website and take advantage of these, sign up for them. They're free to the public. We just ask that you RSVP so we can make sure we have good head counts. And with that, I thank you for the time and glad to answer any questions.
Any questions for David? Alrighty, David, thank you.
Thank you.
Let's see, we have nothing on the consent agenda. Do we have any public comments?
No, sir.
All right, legal matters. Nothing. Jeez, I'll tell you, any other business for this group? Hearing none, we stand adjourned. Thank you very much. Happy Thanksgiving to everyone.